Good afternoon, everyone, and welcome to my presentation. I want to remember you one thing, that we had a good session with media in this lunch, before lunch, and they were asking about why the birth rate was not controlled. So my presentation is going to answer that. So we studied married women, and we wanted to explore whether the pregnancy decision is depending on women or somewhere else. And we know that women in our country, they have, especially in the rural area, they have low autonomy that often makes difficulty for them to decide when to get pregnant and take reproductive decisions. So in our literature search, we found that we have low understanding about how the decision is made in the rural area. So we studied married women in Ukhia sub-districts, in Jaliyapalong, Rajapalong, and Palongkhali Union, and the study was qualitative descriptive design. We tried to understand different types of experienced women who had abortion, one birth experience, multiple birth experience, to know their experience about deciding the pregnancy. So to analyze this, their experiences, we used a theory called social norm theory, because in most of the research we found that the women report that was not fully understood academically. So we use this theory. So social norm theory is about the interpersonal influence. So we did not use the full theory. We used two components, that is empirical expectation and normative expectation. Let me clearing what is this. Empirical expectation is that when one individuals believe what others should do, and normative expectation is that when an individual have the awareness that what others expect me to do. So in this regard, we found that in the empirical expectation, most married women who interviewed, they expected that their husband would allow them 6 to 12 months for getting pregnant. But we found that most of them were pregnant within the 3 or 6 months, accepting their husband's decisions. Also, we found that mother expected, who were multiple birth experience, that from the one birth incidents to another, there should be 2 to 3 years gaps. But most of them means 4 we interviewed, had, again they got pregnant within the 3 months and got aborted. So we wanted to learn what is the normative expectation. Normative expectation is that the women had belief and awareness that her husband, her mother-in-law, her parents, her sister-in-law, her elder sister, everyone wants her to participate in the decision of her husband to get pregnant. Because to secure a better conjugal life, a good relations with the husband, and also to be an ideal housewife, she had to accept normative social pressure. So, and then we found that when an individual think the way she will live, she will decide. But in case of our mothers in rural area, what society wants, what her family wants, what her husband wants, she had to accept that. And this is why I think the media people were asking, why not the women, we cannot control repeated birth and distance between one birth to another birth. Actually, this research in some way answers that questions. So thank you. This is the short experience of our research team to share.